Opioids, some of the most powerful drugs in medicine. But how do they work and why can they be so dangerous? In this video, we'll break down pain physiology, opioid pharmacology, and addiction management. Pain starts when your body senses damage. Through special nerves called nociceptors, they convert injury into an electrical signal. The signal travels to the spinal cord, crosses synapses using neurotransmitters like substance P and glutamate, and continues to the brain, where pain is actually felt. Opioids are drugs that reduce pain by acting on the nervous system. They come in three main types: natural opioids, semi-synthetic opioids, synthetic opioids. All opioids work by binding to mu-opioid receptors, mu receptors, in the brain and spinal cord. This blocks neurotransmitter release and dampens pain signals. Some have extra features. Tramadol also blocks serotonin and norepinephrine reuptake. Methadone has a long half-life, useful in withdrawal. Fentanyl is ultra-potent and fast-acting. Each opioid has specific medical uses. Morphine, severe pain, heart attacks. Codeine, mild pain, cough. Oxycodone, post-surgical pain. Fentanyl, cancer pain, anesthesia. Methadone, chronic pain, addiction therapy. Tramadol, moderate pain, neuropathic pain. Because opioids act throughout the body, they cause side effects related to their mechanism. Mu receptors in the brainstem reduce the urge to breathe. This can lead to overdose death. Mu receptors in the gut slow motility, leading to constipation. Opioids stimulate the chemoreceptor trigger zone, causing nausea and vomiting. Opioids release dopamine in the brain's reward circuit, causing intense pleasure and eventually addiction. Opioids are dangerous in respiratory diseases like COPD, asthma, head injuries, liver, surge, kidney failure with alcohol or sedatives. Fentanyl, used medically for cancer pain, is now made illegally and mixed into fake pills. Just 2 milligrams can kill. Addiction can be treated medically with methadone, long-acting opioid, buprenorphine, partial agonist, naltrexone, opioid blocker, naloxone, Narcan, emergency overdose reversal. Opioids block pain but affect many systems, leading to side effects and addiction risk. Use with caution, monitor closely, and always prioritize safety. Like, subscribe, and share this video if you want more whiteboard breakdowns on medical topics and help spread awareness about the safe use of opioids.